Nixar tablets is an antiallergic drug. A significant therapeutic effect is observed an hour after taking the drug. The antihistamine effect persists for 24 hours. Active ingredient Bilastine. Bilastine is a non-sedative, long-acting antihistamine. Indications: allergic seasonal year-round rhinoconjunctivitis, elimination or relief of symptoms, sneezing, feeling of nasal congestion, itching of the nasal mucosa, rhinorrhea, burning sensation and itching in the eyes, redness of the eyes, lacrimation, urticaria, elimination or reduction of skin itching, rash. How to use: inside, unless otherwise directed by physician, the following doses of Nixar are recommended for relief of symptoms of allergic rhinoconjunctivitis and urticaria. Adults and children over 12 years of age, 1 tablet of Nixar, which corresponds to 20 mg of Bilastine, once a day. The maximum daily dose of Bilastine is 20 mg, since increasing the dose does not lead to an increase in the therapeutic effect. The tablet is taken 1 hour before a meal, or 2 hours after a meal, or fruit juice. In allergic rhinoconjunctivitis, the drug is used during the entire period of contact with allergens. With urticaria, treatment is continued until the symptoms disappear or alleviate. In patients with impaired liver and kidney function, dose adjustment is not required. In elderly patients, dose adjustment is not required. Contraindications: hypersensitivity to Bilastine or auxiliary components of the drug. Age up to 12 years. Efficacy and safety have not been established. Pregnancy and breastfeeding. Special instructions: if you have moderate to severe kidney problems and are taking other medicines, talk to a doctor or pharmacist before using Nixar. The drug should not be taken with food or with grapefruit juice or other fruit juices, and the effect of Bilastine is reduced in this case. To avoid this, you should take a pill either 1 hour before a meal or fruit juice, or 2 hours after eating or after drinking fruit juice. When used at the recommended dose of Bilastine, 20 mg, it does not increase alcohol-induced drowsiness. Side effects: herpes of the oral cavity, increased appetite, anxiety, insomnia, drowsiness, headache, dizziness, blockade of the right leg of the bundle of His, sinus arrhythmia, shortness of breath, nasal discomfort, pain in the upper abdomen, abdominal pain, nausea, itching, fatigue, fever.